You heard the RBI, and I'm not minimizing this in any way. I'm simply trying to put the numbers into context. What is your take?
Well, I mean, obviously, any death is tragic to those who love that individual. But you're exactly right that when you look at just how effective these vaccinations are, it's really remarkable. When you look at San Diego, for example, in California, what you see is 8 times the number of unvaccinated people are getting sick than the number of vaccinated people with COVID. And what we know with vaccinated people is you have a much higher likelihood of having mild symptoms and not being hospitalized and not dying. And that's really a testament to the work that's been done on the vaccine side. I'd like to see a little more progress on the therapeutic side as well as we anticipate more variants. But right now, we have to say the vaccines are working, and the more people that get vaccinated, the less likely we are to have even worse variants coming down the track.
And that's such an important point now also about treatments. Treatments have gotten a lot better, and certainly there's a lot of drugs that are out there. We don't talk about them very much. We talk a lot about vaccines, but we don't talk a lot about treatments. There are some things that are out there already, and there are some very promising trials that may be close. Are there not?
There are, no question. I think Merck has a great product, and the government initially took a pass on it with the leadership at BARDA, but before Merck acquired the drug from a smaller company, but hopefully we'll be able to get that out the door in the next couple months. That really could be a game changer. Our goal here really is to accept the fact that we're not in the days where we're going to make COVID completely go away. People like to talk about herd immunity and we'll no longer have any cases in the U.S. Sadly, we're past that point. We missed that opportunity early in the pandemic with failures at CDC on the testing front and a lack of preparedness on the public health side. So now we're looking at really what's going to become endemic, which means we're probably going to need booster shots, just like we need yearly new flu shots to help alleviate the spread of really bad flu in the United States. But going forward, I think we can manage this in an effective way without having to worry about lockdowns or dramatic changes to people's lives.
Yeah, and we talk about and again, Dr. Gottlieb has done a lot on this. He's talked a lot about this as well. These are not my words, these are his. And you got to remember the 1968 pandemic, which killed more than 1 million people worldwide. That's a low estimate, by the way. H3N2, which kind of has become our flu, which, by the way, is still deadly to a lot of people every single year. Do you anticipate, Chris, that ultimately that COVID, the Delta variant, there's going to be other variants as well. I'm sure you would agree with that. This will ultimately morph into something that, sadly, we are going to have to live with in some way for the next few years, if not decades, like the Asian flu in 1968.
Yeah, this is going to be with us a pretty long time. You know, Scott and I both worked together at the Department of Health and Human Services. I was in the area of public health preparedness. He was obviously at FDA as we were looking at what potential things could come down the pike. And the reality here is this is something we're going to have to deal with every year. But hopefully with effective treatments and people getting vaccinated, we can limit the potential really problematic variants. What we saw with Delta is it's much more transmissible. Facts from the CDC says it could be as transmissible as chickenpox at this point. So bottom line for the viewers here is if you don't get vaccinated, you're probably going to get COVID at some point. And if you're unvaccinated, the odds of you being hospitalized or dying are much higher. So Chris, hopefully people will get vaccinated.
Chris, before we let you go, I know we got to go, but I got to ask you this too. That CDC study getting a lot of attention based on a very small group, you know, Provincetown, Mass, kind of during a party week. Do you read into that CDC report as much as the headlines came out? Because it's almost kind of like saying, well, you know, we took a sample from a week at Mardi Gras when it was raining and everybody was packed into bar. That's seriously, it's kind of a party week. That's the data set that they had or they chose to use. What's your take on that?
I'm not saying people need to dramatically change their lives. What I will say is if you're unvaccinated, you need to be more careful about what you're doing. Ideally, you won't use just one of the gaiters or cloth masks. You'll get an N95 or KN95 because of the way this virus is. But people should be able to continue going out to restaurants. Just this weekend, my wife and I went out to restaurants. We went and did some furniture shopping. shopping out in the public. We haven't changed despite an increase in Delta here in Washington, D.C. So I think people can go about living their lives. It's just a matter of being more cautious if you're unvaccinated because you are at higher risk.
Shepard Smith here. Thanks for watching CNBC on YouTube.